So the word cloud, I really just wanted to highlight the vast range of symptoms that can occur even from quite early on. And of course, the words that are bigger are the ones that are much more frequent. We know that around 60% of pregnant people can start experiencing one or more of these symptoms from as early as 5 to 6 weeks. And by 8 weeks, probably 90% of people are experiencing one or more of these symptoms. What's common gastrointestinal issues? So probably anyone's heard of nausea or morning sickness, although more often than not that is throughout the day rather than just in the morning. We know that up to 80% of pregnant people will experience nausea and up to 50% will experience vomiting. It usually subsides after the first trimester, can go to like 16 or 20 weeks, but noting that that is half of the pregnancy, that someone might be feeling quite average. Keeping something in the stomach, like plain crackers, very small, frequent meals, high carb, low fat, staying hydrated, all of that can really help. Ginger has some good evidence behind it as well. Hyperemesis gravidarum, or HG, is a much more severe form of nausea and vomiting in pregnancy, and I will speak to that in a different presentation. Reflux we can see in up to 85% of pregnancies. So that's that kind of heartburn sensation, that burning feeling, excess burping. It can be due to hormonal changes, due to the muscles around the stomach changing, and then in the later pregnancy, of course, the pressure of the baby pushing on, that it can all encourage the acid from the stomach to flick up into the esophagus, into the food tube, and start causing those symptoms. Constipation we can see in up to 44% of pregnant people compared to around 7% of the non-pregnant population. Hemorrhoids are varicosities in the anal canal caused by increased local venous pressure. They can be itchy, they can be sore, they can bleed, and it occurs in around 30 to 40% of pregnant people. We have strategies to deal with these, so please make sure that your client is coming in to see medical or chatting with their midwife about them. But also these things all sound reasonably common and some of them reasonably simple, but thinking about how this might affect a client's willingness to exercise or ability to even exercise as they once did before they were pregnant. Gastrointestinal, we know that there's a lot of food and drink that people need to avoid. This is a list of some websites that can be quite helpful for a quick reference to know what is safe. We know that there is no safe limit of alcohol during pregnancy, so abstaining, limiting caffeine. There are a range of essentially deli foods like deli meats, cold meats, soft cheeses that are unsafe. That's because pregnancy is considered a condition where you're immunocompromised and you're much more at risk of foodborne illnesses like listeria. Things like folic acid and iodine are really important to be on for baby's spine and brain development, and these things can be scripted by a doc or a midwife. Dietary requirements, we know people need a wide range of fruits, veggies, healthy fats, whole grains, dairy. The eating for two thing has kind of been debunked. We know that in the first trimester, the energy intake is very similar to someone who is not pregnant. In the second and third trimester, people might need around 400 calories more per day than they did before they were pregnant. We know protein needs to increase in those trimesters. Carbohydrates need to increase by about 30%. Fiber needs to increase. And iron, of course, needs to increase as well. Calcium and vitamin D are also very important. I would caution pregnant people around taking over-the-counter or workout supplements. There are things like preformed vitamin A supplements that can be very teratogenic. By that we mean very harmful to the developing fetus. Psychiatric, really, really common, unfortunately. We know that roughly 1 in 10 pregnant people will experience depression or anxiety. This could be a recurrence of an old issue, it could be a new issue, it could be genetically disposed, they might not be at all. Symptoms look fairly similar to what they would in someone who is not pregnant, but looking at some major mood changes for at least 2 weeks that might look like they're crying a lot, very abrupt mood swings, they're withdrawing socially and also not attending appointments, anhedonia, so a loss of joy or feeling and pleasurable activities for them, sleep disturbances, feeling nervous or panicky, feeling unable to cope, and can be to the extent of suicidal ideation as well. So please make sure that these people are seeing a doctor and have let their midwife know as well. If untreated, depression can lead to effects on the fetus, for example, their neurocognitive development, so a really important one. What are some neurological issues? Insomnia is really common, and unfortunately before baby gets here you often want to be sleeping as much as you can, but sometimes that is just not possible. The causes of insomnia will change throughout the pregnancy. They might have a lot of nausea or reflux, and then towards the end of the pregnancy it can be very active fetal movements. Keeping in mind also that from roughly 20 weeks, pregnant people cannot safely lie on their backs due to the compression on the inferior vena cava from the weight of the baby, the fluid and the placenta. That can reduce venous return to the heart and then affect cardiac output. So people need to make sure that they're lying on their side from roughly 20 weeks. And of course that will impact what kind of exercises you're asking pregnant people to do as well. Baby brain and memory issues reported in probably up to about 80% in a study I came across, and fatigue obviously really a huge one, and up to at least 90% of pregnancies they will experience fatigue. And then just some other issues. We know that it can affect the musculoskeletal system in terms of sacroiliac pain, lower back pain, but our pelvic physio will speak more to that. Hematological changes, iron deficiency is incredibly common. If untreated, that can lead to an iron deficiency anemia. And we know that around 40% of pregnant people worldwide have iron deficiency anemia. Symptoms will be fatigue, a reduced exercise tolerance, shortness of breath, dizziness on standing, and a racing heart palpitations. We can treat this with oral iron tablets, though that can exacerbate a constipation issue, and some people do need an infusion as well.